In July, the United Nations Health Agency designated monkeypox as a global emergency and appealed to the world to support African countries so that the catastrophic vaccine inequity that plagued the outbreak of COVID-19 would not get repeated. But the global spike in monkeypox infections has had little impact on Africa. No rich countries have shared vaccines or treatments with Africa, and some experts fear interest may soon evaporate. But why is this the case when it comes to the continent, or rather, this often forsaken part of the world?
In the second week of September, the head of the World Health Organization, Tedros Ghebreyesus, gave a status report of the two viruses that have wreaked havoc across the globe. His concern was all about the latest and newest headache, monkeypox.
Meanwhile, the downward trend in the global monkeypox outbreak is continuing. But as with COVID-19, this is not the time to relax or let down our guard. This is the time for all affected countries and communities to keep doing what's working.
The number of monkeypox cases reported globally declined by 21% in the first week of September, after a month-long trend of rising infections. Since the WHO declared the outbreak, over 41,000 cases of monkeypox and 12 deaths have been reported from 96 countries, with the majority of cases from the United States. There was another blurred line in the WHO's report: vaccines to fight the virus. Since the onset of monkeypox, there have been various doses that were administered mostly in Europe and the US, countries that were considered at risk and vulnerable. However, when the cases were reported in Africa, no rich countries shared vaccines or treatments with Africa, something that was alarming. Virologists in the continent lament that the countries in Africa where monkeypox is endemic are still in the same situation. According to WHO's Africa Director, Africa is still not benefiting from either monkeypox vaccines or the antiviral treatments. Doctors in various African countries say the lack of help for Africa was reminiscent of the inequity seen during COVID-19, where everybody looked after their own problem and left everybody else. That forced the World Health Body to act and hastily set up a COVID vaccine hub in South Africa.
So the idea is, although we chose South Africa at the center as a global hub, the idea is to build global capacity, especially in countries, low-income countries, to have their own capacity, so the equity issue is addressed in the future.
Some leaders from the continent also reacted and put pressure on the developed world to listen.
The inequalities and disparities we are seeing in the distribution and production of COVID-19 vaccines are symptomatic of an old geopolitical framework that is no longer working, no longer sustainable, and no longer acceptable.
Monkeypox has sickened people in parts of West and Central Africa since the 1970s. But it wasn't until the disease triggered unusual outbreaks in Europe and North America that public health officials even thought to use vaccines. Rich countries have stretched their vaccine supplies by using a fifth of the regular dose, but none have expressed interest in helping Africa. Since the WHO declared monkeypox a global emergency, Nigeria has seen the disease continue to spread with few significant interventions. Experts say even if rich countries start sharing monkeypox vaccines with Africa soon, they shouldn't be applauded. Bureau Report, WION World is One.
WION is now available in your country. Download the app now and get all the news on the move.